Welcome everybody. Welcome back to our digital spotlights. You're tuning in to Desk Careers from Dubai English Speaking College, and I am super excited to introduce you to our next guest, Dr. Layal, who is a general dentist living in Dubai all the way from Quebec, Canada. What an exciting spotlight to be on. You know, I'm Canadian as well, so this is a really exciting one for me. But welcome to our platform, Dr. Layal.
Thank you. Thank you for having me, Maria.
It's so great to have you here. And I know that we have lots of aspiring medics who will be watching this spotlight, and probably teachers and parents and members from our community. So let's get into everything that you would describe as the world of being a general dentist. And also we can add the element and the flavor of practicing in a country that probably isn't the country that you trained in and probably started your career as well. So let's start right at the beginning with the question I love to ask the most, and sometimes a question that leaves our guests thinking, is who is Dr. Layal in whole essence?
So, word of advice, this is probably the first question that you're going to get when you go for an interview at dental school.
Excellent.
So you really have to think about it. Now, given that I've already passed all that, I'm going to keep it light. So I'm Dr. Layal, and yes, I'm coming all the way from Montreal, Canada. I've been in Dubai for about a year now, and I'm a practicing general dentist with a focus on cosmetics. And I've been involved in a lot of different things. I didn't start with dentistry right away. At the beginning, I wanted to actually become more of a researcher at university. So I started with physiology, then I did a little bit of business. And then after that, the main point of this is that you never know what you want to start with at the very beginning. So it's very important to, see if you can shadow people. Like I shadowed a doctor in a hospital to see if I wanted to become a physician. I also shadowed my mother's friend who's a dentist. She forced me to do that. She said, come on, go see. I don't want you to be living the hospital life. And I actually tried that and I fell in love. So that's basically me. And now I've been here for about a year in Dubai. It's been quite a change. But I'm glad I escaped the cold. In Montreal, it can get pretty cold in winter. You're talking maybe minus 30, minus 40 degrees Celsius. So,
I love that you took us on the being a dentist, because I think a lot of young people assume that if I'm going to be a doctor, I'm going to do it right from the beginning, or if I'm going to go into dentistry, I'm going to do it right from high school or college. So you didn't go directly into that path. What would you tell us in the journey? Because I'm sure you've met people now in your practice or when you're working that did do that direct journey from school straight to medical school and then into the dental practice. So what tips can you offer anyone listening that might think, oh wow, that's so great?
Look, when you make a decision about a career, it's very important to really, you think that this is what you want, but at the same time, it's really important to start talking to people, to actually start shadowing people. I even in my class, I had people who were engineers, actual engineers that were practicing for 5-6 years, and they realized it wasn't for them. And they went back to university, did the sciences again to get into dentistry. So number one advice, try to do also a lot of the career questions, the career assessments also. Keep an open mind, watch YouTube, go shadow people, see if this is really something that you could do. I'll mention this. At the beginning, as I told you, I wanted to become a researcher and then decided to become a physician. And I actually got in. But then halfway through, it's just not even halfway through, 6 months into the program, which I am a little bit fortunate because the first 6 months of dentistry and medicine at McGill, which is the university I went to in Montreal, they overlap. So after 6 months into the program, I kind of realized, no, I didn't want the hospital life. I didn't want the emergency life. So I switched. And the reason I switched is because during that time, I also shadowed multiple dentists. I went to multiple clinics, and it wasn't because I wanted to. My parents, give it a try. At least you're still a doctor, but you've got it's more of a lifestyle. And I wanted that flexibility. I wanted that lifestyle. So you really have to sit down, with yourself, really think, do I want to be on call all the time? Do I want to be giving all the time? In dentistry, you can also give, but you also have that flexibility of maintaining a certain lifestyle as well. Like, I know at the end of the day, I finish at 6, 7 p.m. I go home, it's done. So,
Excellent.
yeah.
Smooth lead into my next question is, take us through a typical day of being a dentist. What is it that they don't teach us at school?
The reason that I love the profession so much is that in dentistry, especially, I mean, a lot of people think that you should specialize, go into certain specialties, whether it's endodontics, periodontics, which is like root canal treatments, or gum disease. What I like about it is that you go in, you've got your schedule ready to go. You've got patients that have different things to do, different procedures, and I like that variety. I don't like to be doing the same procedure over and over again. And they always say, there's that quote, it's like a dental practice, or the patient pool that you get at dentistry, it's like a box of chocolates. You never know what you're going to get. So every time you meet new people, you meet their families. And what's nice about the profession is that, you do the treatment, you get them out of pain, you see a smile makeover, you get that instant satisfaction right away. And this is what I find really nice. And at the end of the day, you go back home, you feel you've accomplished something, and with your own hands, you're creating something. And at the end of the day, once you've done the procedure, whether it's like, anterior fillings or veneers, the people are going to walk around with your name, your brand, your work. So it's also very important that you always give it its best.
Excellent. Talk to us about the customer service and the administration behind the work that you do.
Look, the dental practice, you probably heard it, that the dentist is the most important person in the clinic. I do not agree with that. It's really all about the dental team. Because great, the dentist at the end of the day will do the work, but the first impression, patient walks in, there's the dental secretary. This is one role that people can look into. She does need to have a little bit of knowledge of the dental terms, dental terminology, how dental insurance works. And then after that, also, you've got the dental hygienist. She's the step before the dentist. And what she does, it's more in Canada. I don't know much about it here. I know it's not very big to have dental hygienists, but they do play a very big role in the UK, from what I know, and in Canada, is that they do the exam, they take the x-rays, they do the cleanings, and then the dentist comes in and checks. So you also have to go through dental hygiene school in order to become a hygienist. If I'm not mistaken, I believe it's a 2 or 3 year program. Another very important person is also the dental assistant. The dentist cannot do any work without a dental assistant. So it's a team effort at the end of the day. And I was practicing in a clinic in Montreal for about 7 years. And it's so nice to hear that, when I'm working with my assistant, that the patient is just so surprised that we're just working. Our hands are just going like this. And it's like not even one word is being said, because the chemistry is so strong and we really understand each other.
That's
so
amazing.
there are different roles in a dental practice. You don't necessarily have to be the dentist. So it also all depends. You really have to look, observe, talk to people, because it's something that you're going to be doing for the next, 15, 20, 30, 40 years even. I know a dentist that's practicing, he's over, 75, and he's still practicing. He's got more energy than me and you.
Fantastic. So what would you say a dentist has to do to build that rapport with their clients, with the customers, something that they won't teach you in a maths class or science class?
Now that's a very, very good question, because I realized that upon graduating from dental school, in dental school, there's only so much they can teach you. They teach you the clinical aspect of dentistry, how to do certain procedures, how to deal with complications, and so forth. There's a lot of science, a lot of skill that you need to, get. And there's a lot of things that they don't teach you. And this is where you have to keep an open mind, always read, always stay updated, listen to dentist podcasts, because patient communication is key. At the end of the day, it is a business. People come to you because they need to like you. They need to feel there's a chemistry. You need to be able to talk to people. You need to be able to crack a joke, because, the best thing about dentistry, I find, is that, or my ideal, this is what I like to be, is that I'm a family dentist for a family, not for a year or two, but for a lifetime. This is what's very nice. You're going to grow with the children. You're going to grow with the parents and the family. And this is what I find very rewarding.
So great. So what subjects, if you can reflect back to being a younger Dr. Layal, what subjects would not have been the ones that you would have assumed would be the best value for you, but now upon reflection you think, man, I wish I spent more time paying attention?
Like, I'll tell you one thing. When I spent about 9 years studying at McGill. I did my bachelor's, my graduate diploma, and then my dentistry as well. And reflecting back, I'm very glad that, because the first year McGill told us as a freshman is that try to be well-rounded, try to be involved in a lot of things. You want the person to be round, not square. And that stuck with me. So what happened is that throughout my undergrad, and even after that, other than the sciences, you need to take the biology and chemistry and physics, but how much of a person can you become through that? So I took a lot. I minored in business management. I took accounting, economics, finance, and then I took about 3 courses in law. And then I took another course in human resource development. And this is all through my healthcare administration diploma at McGill. So at the beginning, I'm like, okay, I don't know why am I doing this, but you know what? Something felt, keep going. And now looking back, sometimes I talk to dentists, they're really so focused on the dentistry, they don't know what's outside that square. But yet again, I can talk about finance, I can talk about economics, I still follow up on this. So it helps even when you communicate to patients, if someone comes in, oh, I work in finance, you know what to talk about. You need to be that conversation starter. So always look at other courses. Like, even you like art, do it. You like music, do it. It's always think circle.
So I love that you talk about business as well, because being a dentist, not only are you a practitioner, but you're also with one eye on the business, because it is a competitive field.
Yeah.
Would you agree? It's a really competitive field. And I always say there are certain people or professionals that I look to and I think I need them, but I need to feel that there's more than just the business. So how do you advise young people to remember that you're a practitioner, but you're also in a business, in an organization, and what tips can you offer them from that perspective? Because you're building a clientele as well, aren't you?
100%. To be honest, again, it's very important to always stay up to date, not only in dentistry, with the world, with other professions, with what's going on. Even like sometimes I read about AI, artificial intelligence and all this, and 3D printing. And you know what? It's now being implemented in dentistry. So you need to know about these things. You need to know about what's going on in the world. So just always have an open mind. Always look into news other than dentistry. Always keep up to date with what's happening in the actual profession, because it is a business. There is competition. And, this is how you want to stand out. And again, another thing right now, as we know, a lot of it has shifted into the online world. You need to be open to adapt. You need to be on social media more. A lot of dentists, given the whole situation with what's been going on the last few weeks, they just closed their clinics and they disappeared. No, this part is where you have to show that you're there. You have a presence. You follow up with your patients, that you're a caring person. That at the end of the day, you're not just treating a mouth, you're treating a human. They have stories, they have a life. So
fantastic. Now, you talked about one of the things that you love the most is that you're growing with an individual, with their family. What would you say would be the moments to remember in your profession so far?
Apart from the instant, let's say, rewards that you get when you see, they come in with a broken front tooth, or, not very aesthetically nice front teeth, and you've done something, let's say, even if it's bonding, within an hour it's done. You see that big smile, people tearing, that I find very rewarding. And another thing is that I do a little bit of pediatric dentistry as well, treating children. And what's really nice is that when the first appointment, they walk in like this, you can't really do much, and I don't want to be I always tell parents, I don't want to be responsible for their bad experience, because this is why you start avoiding going to the dentist. So, It's always meet and greet, you familiarize with everything. And what I love is that by the second, third, or fourth appointment, they're coming in, they're sitting down, they're opening their mouth by themselves, they're good to go. And this is where I find I really did something and I changed that child's perception of the dentist.
Oh, I can resonate with those children. So what do you say as a student learning to be a dentist? What would you say would have been the things that you think, oh wow, that was like a memorable moment, or oh, I wasn't ready for that coming out of high school?
Look, if I can tell students something, is that you think you have it pretty hard in high school. You really think you do. And especially, I mean, I can kind of, you told me it's a British school. I did, even though I went to an American high school, I did the British system. I did O levels, I did A levels. And what I would advise is that really focus on them. Even if they're hard, give it your best. You're sitting at home with your families. You've got all the care and support. You know, the meals maybe are being cooked for you. Your laundry is being done for you. Everything's great. Why am I saying this? Because when you go to university, the perks of doing O levels and A levels, or even the AP system, is that I got into sophomore. You skip the entire freshman year. And there's one A level course that I didn't do, which was chemistry. And I ended up doing it in university. And oh my God, was it tough. It was so, you know, if anything, focus on getting those high grades at the beginning. And not only grades, it's not a matter of just GPA. Also do other extracurricular activities so that when you apply to university, especially medical and dental school, they look at other activities. Again, they want a rounded person. They want a circle. They don't want a square. And I'm going to tell you, I did not have the highest grades, but I did a lot of extracurriculars on the side. And this is why I got in.
That's
So if
great.
anything, this is it. Like at university it's tough. It's tough. It's a different life. Don't forget the first year you're gonna go in. You're gonna think, what's happening? Where am I? There's an adaptation period, but at the same time, you need to study and get the grades. You can't slack off.
How do dentists or freshly graduated dental practitioners, how do you find your first job? Where do you go? Who helps you, or does anybody?
Um, Look, after you graduate from dental school, I mean, there are different paths that you can go on to. Some people choose to specialize right away. I mean, I wouldn't recommend it because, I mean, there's maybe over 9, 10 disciplines in dentistry, and specializing right away and thinking that this is what you want to do for the rest of your life, great. Some people, they know exactly what they want, which is amazing. Other people, they graduate, they're not too sure of, you know, they need a little bit more practice, hands-on. So what they tend to do is they apply for a residency program, which is for 1 year. And you're still being, you know, you're working under supervision, you're still taking courses, you're still doing exams. So this is one situation. In my case, I was a little bit fortunate. I ended up working in a private practice fresh out of school. And I really thank my ex-boss when I was working in Montreal. I mean, I started in that clinic and I stayed for almost 6 years. And he really took it upon himself to mentor me, to teach me. And I slowly grew with the practice, and I will forever be thankful. So if you're lucky enough to find a mentor, to find someone who would be there with you from the beginning, I mean, I grew so much. I learned so much in real life versus still being at school. So again, it all depends on what you want. Again, very important to sit and think, read, observe, talk to people, because this way you'll know more about you and what you want at the end.
So great. But how do you go about finding the first job? Is there a recruitment agency for dentists that we should know about, or is it just searching clinics and applying directly?
For dentistry, I mean, unfortunately, it's not very easy. Sorry, it's not very easy to find a job. I find, especially in this part of the world, there isn't really like okay, maybe there are multiple recruitment agencies, but it's very different. Like you really have to go up to clinics. Are you looking for a dentist? These are my qualifications and so forth. Again, I've only been here 1 year. I came in with Canadian qualifications, and yes, word of advice, wherever you go to study, especially if it's abroad, and education by itself is not enough. You know, try to get a couple of years of practice, because this way, you know, for instance, like Canadian educated, Canadian practice, Canadian experience. So even if you go to the UK, try to work over there for a few years after you graduate. And talking back to your question about the jobs, in Canada, there is a dentist association. And this is what I did, is that there's a list of jobs. You really don't know anything about the clinics. You just apply, you do the interview, and I mean, you get the job, give it a try. And that's all. It's pretty
So,
simple.
and it's so important because young people don't really understand. They think that they're going to study and then, but where does the job come from? There's the whole process of knowing how to apply for work. So what
Yeah.
would you say a great dentist CV would look like? Like, what are the top things that you think need to be on that CV for anyone that is ever going to apply for that first job?
Um, I mean, looking back, other than, of course, your dentistry degree, look, I'll be honest with you, like the super high grades, 4.0 GPA, no one's going to ask you. Okay, so what's important is that they look at other things. Like for me, for instance, a conversation starter when they look at my CV is that, oh, you did a minor in business. Oh, and you did a graduate diploma in healthcare management. Tell me more about that. Okay, or for instance, like I was involved in a lot of extracurricular, like volunteer work. There was a McGill outreach program that I stayed with for almost 3 years. Oh, tell me more about that. It's really things like that that are, again, conversation starters. And when they see this, they actually see that, oh, okay, you're not just focused so much on the clinical aspect of dentistry. We can actually have a conversation. We can see you grow with us long term.
That's so amazing. So any students listening to this or watching this, I encourage you to really digest the message that you're hearing. I know that young people, Dr. Layal, think it's all about the grades, and because the grades are really an indication of the next academic journey. But what we want them to understand is, like you said, we're not a box. We want to be more of a circle and get outside the box and really round yourself with experiences. What would you say now to young people considering applying to dentistry? Because a lot has changed. You mentioned AI, you mentioned technology. A lot has
Mhm.
changed since you were first a student at dental school. What do you now see for new entries into the profession that you think, if you're listening, pay attention, because these will be things that you really should keep your eye on?
Um, Look, I would start off by saying whatever's been happening, let it not discourage you. Dentistry is a very rewarding profession, and I'm not saying it just because of there. I'm in it. I really love what I do, and I love the lifestyle aspect of it. I love the instant gratification that you get when you see, after you do like a smile makeover, people are so happy with it. I love the aspect that you're creating with your hands. But you need to be open to adapt. You need to be able to cope with high stress levels because it is a stressful profession at the same time. Don't forget you are dealing with, usually the pain aspect. People are already on high alert, very emotional. You need to be able to maybe do a little bit of psychology. You need to understand emotions. So let that not stop you because, as I told you, it's a very rewarding profession. At the same time, you're always going to be in demand. Dentistry is not going anywhere. People are always going to get cavities. People are always going to have gum disease. So you shouldn't worry about the profession. We're always going to be needed.
Yeah, definitely not going to worry about it. As long as we have we we have teeth, there's always going to be a need for a dentist.
Exactly.
How has COVID-19 changed the practice and the profession?
Look, we are in a very high risk profession, and I know there's been, for dental practices abroad, a lot of clinics have shut down. Here in Dubai, we've been limited to basically emergency care, severe pain, swellings, all this. It's just because there's a lot of aerosols that are being generated. And at the same time, the PPEs, which is the protective equipment that we use, we also need to share them with the hospitals, the frontline workers that are directly working with the COVID patients. So what we've been trying to do is that to minimize patient contact, if it's not necessary, we've been doing a lot of virtual consultations through Zoom. We're trying to do assessments. Of course, in dentistry, it's very difficult to do everything because you need to take x-rays, get your hands in there, do a few tests. But the virtual consultation, especially for follow-up appointments, they've spared a lot of visits. A lot of patients tend to come in, you do the initial consult, you know what they need. They come in, they don't want to spend a lot of time at the clinic. So you make your appointments longer, you do more within that hour so that they avoid coming back. And of course, we're taking extra safety precautionary measures, but we're already, us dentists, we're very good at safety protocol. We're always very good at disinfection and all this. So just, a few extra steps here and there. In the waiting room, for instance, there are no magazines. People come in, we screen them, questionnaires, temperature, hand sanitizer. They sit apart. So we need to adapt, and it's okay, right?
Excellent. Yeah, definitely. Most definitely. Thank you so much, Dr. Layal. So much
Thank you.
information. One last question is something I'm always talking to young people about, and it's languages. How would you say languages are either relevant or important in your profession?
I mean, look, apart from the fun part of learning a new language, look, the more you learn, the more it's better for you. And at the same time, you're better able to communicate with patients at the same time. I mean, when I went in Montreal, at McGill, I was studying mostly in English, but then, I did a little bit of French. I became pretty fluent. I did a little bit of Spanish. I know a little bit of Arabic. So it's always good to know multiple languages, and you get let's say you get more clients, this way.
Of course.
I
Yeah.
have a friend that's actually learning Mandarin, so why not? Everyone's saying it's probably the next language after English right now.
So super, so fantastic. Thank you so much. Dr. Layal,
Thank
I
you.
know we're going to have a lot of people wanting to reach out to you, if not the Canadian community, knowing there's another amazing Canadian dentist in the country. But for
Thank you.
anybody that is either thinking about meeting you in person and being a potential customer one day, or even a young person that might be looking for a mentor, how can they reach out to you?
Um, I'm always available if you have any questions. And again, very important, like if you need a mentor, I'm there. I can be that person to guide you from A to Z, because there's a lot of things that I wish I knew when I was younger, going through the journey. You can contact me on my Instagram page, The Tooth Hub, or at my email, thetoothhub@gmail.com. And I've also got my website, which you can find on Instagram, thetoothhub.com. Currently, I'm working at a clinic in Dubai Festival City, True Smile Works Dental Network. So if you need a consultation, you'd like to just come have a chat, we're here. And I'm really looking forward, and I really hope this was helpful. I thank you, Maria, for this.
No, this is amazing. Thank you so much, Dr. Layal.
You're welcome.
I can hear a lot of kids ticking on their computers right now. It's so amazing to have you here, and a big thank you for giving us your time today.
Thank
And
you.
that brings us to a wrap with our digital spotlight speaker, Dr. Layal, who you can find on her social. And for anyone watching this, if you're an aspiring medic, if you're not thinking about medicine, but now after watching this, you're thinking, wow, maybe dentistry might be the thing for me, then definitely reach out and we can support you at Desk Careers. Join us again next week when we bring another amazing spotlight speaker. Thank you for watching, everybody.
Thank you.